Good afternoon, everyone, and welcome. My name is Hillary-Anne Crosby, and I'm a community engagement advocate with the Montana Sexual and Reproductive Health Collective. We're a group of organizations and individuals committed to protecting and progressing healthcare and access here in the Treasure State. Today we have a few members of our group here. We have Susan Wicklund Fund representing Blue Mountain Clinic and Planned Parenthood Advocates of Montana, all here to celebrate Groundhog Day and lament this tired loop that we find ourselves stuck in terms of tired attacks on sexual and reproductive health access. And just as an aside, this morning, Phil Punxsutawney predicted that there will be 6 more weeks of winter, but a friend assured me that he's only correct about those predictions 40% of the time. And meanwhile, in an August poll, we saw that 70% of Montanans do not believe that the government should prevent us from making private healthcare decisions. Today, we're joined by special guest, Representative Laurie Bishop. She's known in these halls as a devoted public servant who has sought every step of the way to work with colleagues of both parties and to stand up for the rights and well-beings of Montanans. Welcome, Representative Bishop.
Thank you, and thanks everyone for being here today. I am Representative Laurie Bishop from House District 60 in Livingston, and I serve as the Minority Vice Chair for the House Judiciary Committee. And I have served on House Judiciary for all 4 terms now that I have been here in the House. So I've had an opportunity to have a front row seat for all of the legislation that we're considering today. And I've sat in the committee room as a woman who was not pregnant, was not planning to be pregnant, and I've read policies that would shut down procedures that I myself was considering to manage my own health care. So I've seen firsthand that the policies that we're talking about are not about protecting health for anyone, and they're not about the best well-being of Montanans. Really what we're talking about is policies that are aimed at shutting down the freedoms of some for the opinions of others. So I want to just bring you to what is different about this session for myself and my colleagues who are showing up for this fight every day. When we look back on the last session, we saw, as an example, LR 131. That was a bill that was brought forth as an initiative to put on the ballot, but that bill also had a policy companion. There was an opportunity for this legislature to be able to pass that bill, and we know that it would have passed. And they chose not to do that. And they chose not to do that, I feel, because they wanted to maintain the power of the majority. And they felt that driving the majority to the polls would be to the benefit of the majority in this building. And what we saw, indeed, was that having that policy come forward on the ballot initiative was in favor of the majority of Montanans. And the majority of Montanans showed up and showed what they have told us all along, which is that they believe in protecting the reproductive rights of women. And they believe in privacy. They showed us they believe in privacy on that ballot. They showed us they believe in protecting reproductive rights. And lastly, they showed us that they believe in protecting an independent judiciary that protects the Constitution upon which our rights are based and given. So we walk into this building, this session, in full faith and good conscience, knowing that we are doing the work of the majority of Montanans, and it's really my honor to get to carry that message. Thank you again for being here today. I'm really excited for you to hear from those who are on the front lines of this work every day.
Thank you, Representative Laurie Bishop, for your tireless advocacy not only for sexual and reproductive health and rights, but for all Montanans' well-being. So thank you so much. I'll next introduce Aileen Gleizer. Aileen Gleizer is a board member of the Susan Wicklund Fund.
Thank you, Hillary-Anne, and thank you, Representative Bishop. I'm the vice chair of the Susan Wickland Fund, and I also work for Blue Mountain Clinic in Missoula. More than 40 anti-choice bills have been introduced in Helena this session. These policy proposals go against Montana's Constitution and right to privacy, and we've seen them again and again, year after year. Why are our legislators pushing policies that harm and eliminate these fundamental rights when pledging financial relief and cutting red tape? The Susan Wickland Fund works with providers across the state, including Planned Parenthood, Blue Mountain Clinic in Missoula, and all families health care in Whitefish to protect access to abortion. We provide financial assistance for people seeking abortion services and believe no one should be denied an abortion because of an inability to pay for services. Abortion is safe, legal, and exceedingly common. 1 in 4 people who can get pregnant will have an abortion in their lifetime. The policy proposals that we're highlighting today are dangerous and detrimental to health outcomes and equity across Montana. Here are a few of the proposed policies that harm patients, add costs, and increase government overreach into our most personal decisions. HB 303 expands the right to conscience to allow health practitioners to deny health care services. It failed last session, and it's back and even more extreme. SB 154 attempts to unconstitutionally exclude abortion from the right to privacy. And the Department of Health and Human Services is proposing a rule change to remove coverage of Montana's Medicaid program by adding more barriers and red tape. It must be deja vu because there's also a bill being introduced in the legislature that is even more extreme. During its public comment, the Department of Health and Human Services received more than 600 letters, and over 80% were against enacting this proposed rule change. In honor of Groundhog's Day, I'll go for it. These policies violate our right to privacy and limit access to health care. Abortion is health care. These types of policies disproportionately impact people who already face discrimination and health disparities, particularly rural Montanans, Black, Indigenous, people of color, low-income families, and young people. The Susan Wicklund Fund is here if you or someone you know needs care to abortion services. I have the pleasure of working with Blue Mountain Clinic and Dr. Caitlin, who deliver primary care and abortion services 5 days a week. In addition to gender-affirming care, mental health services, and full family medicine. Turn it over to Dr. Caitlin. Thank you.
Good afternoon, and thank you so much to my colleagues for speaking. I'm Dr. Caitlin Blau from Blue Mountain Clinic in Missoula. I'm here today as an abortion provider who loves my job. Abortion work is loving and joyful. Having an abortion is a deeply caring and moral decision. The stories of why our patients choose abortion are varied and unique. But at the core of every decision is radical self-love and the undeniable right to bodily autonomy. It is my honor and privilege to help people meet their reproductive goals. At Blue Mountain Clinic, we provide abortion and primary care services to patients of all ages and genders. Our practice is based in trusting our patients to know what's right for them. We follow this guiding principle whether we are trusting a pregnant patient to know their reproductive needs or trusting transgender people to make well-informed medical decisions. It's not a coincidence that these attacks on access to abortion and gender-affirming care are being repeatedly brought forth by the same religious extremists in our state legislature. The ideology behind these discriminatory bills, which attempt to ban essential medical care, is one of fear, ignorance, and control. 2 years ago, I witnessed the chilling effects of the 2021 legislative session ripple through the transgender community in Montana. 2 of my dear friends fled the state after realizing their safety and access to medical care was at risk. Parents of young transgender teens have asked me if their families need to pack up and move to another state. And after the Dobbs decision in June of last year, young pregnant patients in our office expressed deep gratitude and relief that we were able to help them because they had been afraid that abortion was no longer legal in Montana. The same tired rhetoric has been used over and over again to cause deep harm to our communities, even if the bills are ultimately struck down as unconstitutional. We cannot stand by and allow our patients, friends, and neighbors to have their basic human rights threatened. Discriminatory legislation will ultimately have devastating social and economic effects on our state and its citizens. Blue Mountain Clinic is proud to join with our fellow Montana abortion providers and advocates in the Montana Sexual and Reproductive Health Collective. Through our work with the collective, we hope to promote legislation and advocacy that moves the conversation about these issues forward toward an inclusive future based in our collective freedom. As healthcare providers who care deeply about everybody in our community, we do this work to celebrate and protect queer, trans, and non-binary people, people with disabilities, fat people, Black people, brown people, Indigenous people, and people of color. We are especially concerned about the effects of discrimination on marginalized patients in rural Montana. This work to protect healthcare is just one part of what we are doing to build a future centered on liberation. As medical providers, we will continue to listen to and trust our patients. As advocates, we will continue to fight to keep government interference out of safe and effective medical care. Thank you.
Thank you, Dr. Blau, Representative Aileen, Hillary-Anne. I am Martha Fuller. I am the President and CEO of Planned Parenthood Advocates of Montana. In 1999, the Montana Supreme Court issued the Armstrong decision, which we've heard a lot about in recent weeks. That decision guaranteed the right to privacy, covering abortion for Montanans. As I thought about my remarks, I wondered how many legal notes have shown up on bills since the Armstrong decision. Even this session, we probably could lose count. It's not that extremist politicians aren't aware of the Armstrong decision or of the power of the Montana Constitution, and it's not that they don't know that they will be challenged. Neither of these things stop them. And it's a good thing that you cannot stop the advocates and healthcare providers who stand up for the right to privacy for Montanans in our state. Over the course of 2021 session, we saw a multitude of anti-abortion, anti-trans bills being heard. At the end of the session, Planned Parenthood of Montana sued over 4 anti-abortion bills. Interestingly, along the theme of Groundhog Day, one of those bills that is currently enjoined, House Bill 140, is almost identical to a current bill draft, LC 2623. Same sponsor, same language, same penalties. They're not just identical in language. What we're seeing is bills that are identical in purpose. It is very clear that that purpose is to ban abortion in the state of Montana. But the purpose is also to demean, shame, and stigmatize people who seek abortion care. The purpose is to distract those of us who care deeply about this issue from doing proactive work. And the purpose is to keep us in court. Proof of that is the millions of dollars that were added to the governor's budget for defense of unconstitutional bills. But be clear, we have our own purpose. Our purpose collectively, as advocates, as healthcare providers, is to protect, defend, and expand access to sexual and reproductive health care. And that's why no matter how many times they ignore the legal notes and pass unconstitutional bills, we will always meet that challenge with our own challenges. We will always stand up for our patients and for their privacy, and we will always do that wherever the battle takes us, whether it's here in the building or in the courts. Thank you.
Thank you, Martha, and thank you to everyone for your remarks today, for being here today, and for showing up time and again for sexual and reproductive health care and access here in Montana. I do just want to reiterate something that Dr. Caitlin said. Abortion is still legal in Montana, and I want every Montanan to know that. So again, thank you all for coming here today. We'll go ahead and be more available closer to you so you can hear us for some questions, etc. And after it, I'll also be sharing out via email everyone's prepared remarks in case you had a little hard time hearing today. And then also one note that Keegan Medrano of ACLU of Montana was not able to join us today after all. And so they have also shared their remarks with me, and so happy to share those via email. All right, thank you all.